If you are over 60, I want you to pause for a moment and think about your hands, your feet, and your legs. Not your lab tests. Not your next appointment. Just the parts of your body you use every single day without thinking. Because sometimes the earliest health clues do not start in the chest or the head. They start in the fingers, in the ankles, in the calves, in the soles of the feet. A ring that suddenly feels tight. A foot that burns at night. A leg that aches when you walk to the mailbox. These may seem small, but small does not always mean unimportant. And today, I want to help you understand what many people miss. One of the hardest parts of aging is knowing what is normal and what is not. You may wonder, is this just getting older, or is my body trying to warn me? That question matters, because many older adults wait too long simply because they are trying to be tough. They do not want to complain. They do not want to bother anyone. They tell themselves it will pass. But your body is always speaking. The real skill is learning how to listen without panic, without guessing, and without brushing away signs that deserve attention. What makes this topic so important is that changes in the hands, feet, and legs can be linked to circulation problems, nerve trouble, blood sugar issues, heart strain, kidney problems, medicine side effects, dehydration, and fall risk. That does not mean every symptom is serious. Most are not emergencies. But some are worth a closer look. And a few need fast action. By the end of this video, you will know which signs are common, which signs are easy to ignore, which signs need a calm call to your doctor, and which signs should never be put off. If this kind of simple, caring health talk helps you feel more confident, I'd love for you to stay connected. You can subscribe if you haven't already, and if you feel comfortable, tell me in the comments how old you are and which sign you've noticed most lately. Is it swelling, tingling, cold feet, leg pain, cramps, or weakness? I read those comments, and they help me know what to talk about next. More importantly, your comment may help someone else feel seen, because so many people are dealing with the same worries in silence. Let's begin with one of the most common signs of all, swelling. If your ankles puff up by evening, if your socks leave deep marks, or if your shoes feel tighter than they did in the morning, your body may be holding on to extra fluid. Sometimes this happens after sitting too long, standing too long, or being in hot weather. That can happen to many people. But when swelling keeps coming back, gets worse, moves up the legs, or starts showing up with tiredness or shortness of breath, it deserves more attention. Swelling is one of those signs people often try to explain away, but it can be a clue. Now here is something very important. Swelling in both legs is different from sudden swelling in one leg. If both ankles slowly get puffy over time, that can happen with fluid retention, vein problems, certain medicines, heart strain, or kidney problems. But if one leg suddenly becomes more swollen than the other, especially if it is warm, red, tender, or painful in the calf, that is different. That may be a warning sign of a blood clot. And if leg swelling comes with sudden shortness of breath, chest pain, feeling faint, or coughing up blood, that needs emergency care right away. I want to be calm with you, but I also want to be clear. Those are not wait-and-see symptoms. Let's make swelling easier to understand. Think of your body like a house with plumbing. Your heart helps move blood. Your kidneys help manage fluid and salt. Your veins help carry blood back up from the legs. When one part of that system is under stress, fluid can collect where gravity pulls it down most, often in the feet and ankles. That is why lower leg swelling can sometimes show up before a person realizes there is a bigger issue going on. It is not the only clue, but it is an important one. And when it is new, worsening, or paired with other symptoms, it should not be ignored. Another clue many people overlook is how their legs feel when they walk. If you get a cramping or aching feeling in your calves, thighs, or buttocks when you walk, and it eases after a few minutes of rest, that pattern matters. A lot of people assume this is just aging, weak muscles, or arthritis. And sometimes it is. But sometimes it can mean reduced blood flow to the leg muscles. In simple words, the legs may not be getting enough blood when they work harder. This kind of pain often follows a pattern. You walk. The pain comes. You stop. The pain eases. Then it returns when you start again. That matters because poor circulation in the legs is not only about pain. It can affect healing, balance, skin health, and independence. You may begin avoiding walks because your legs hurt. Then your strength drops. Your joints stiffen. Your confidence falls. And slowly, the things that once felt easy become harder. That is why I never want older adults to dismiss walking pain without asking why it is happening. If you have leg pain that comes on with walking, or you notice cold feet, shiny skin, weak pulses, slow-growing toenails, or sores that heal slowly, bring that up with your doctor. Those details matter. Now let's talk about feet, because your feet can tell you a great deal about your health. If your feet burn, sting, tingle, or feel numb, especially at night, that can point to nerve trouble. Some people describe it as pins and needles. Others say it feels like their feet are asleep, or like they are wearing invisible socks. Some say the bed sheet touching their toes feels strange or painful. This kind of nerve symptom is common in people with diabetes, but diabetes is not the only cause. Vitamin problems, alcohol, spine issues, poor circulation, and some medicines can also affect the nerves. Here is the part many people miss. Numbness can be more dangerous than pain. Pain gets your attention. Numbness hides the problem. If you cannot feel your feet well, you may not notice a blister, a cut, a splinter, a shoe rubbing the skin, or water that is too hot. A small problem can become a serious wound before you even know it is there. That is why daily foot checks are so important, especially if you have diabetes, poor circulation, or reduced feeling in your feet. Just a quick look can make a real difference. You are not looking for perfection. You are looking for change. When you check your feet, look for redness, swelling, cracks, blisters, sores, thick nails, color changes, dry skin, or any spot that looks new. If you cannot easily see the bottoms of your feet, use a hand mirror or ask someone you trust to help. Make sure shoes fit well. Never assume a little rubbing is no big deal if you have numbness. And if you find a sore that is not healing, an infected toenail, increasing redness, or a foot that looks colder or darker than usual, get it checked. Early care is almost always easier care. Cold feet are another sign people ask me about all the time. Some people have always had cold hands and feet. That alone may not mean trouble. But if your feet are suddenly colder than usual, if one foot is colder than the other, or if cold feet come with pain, numbness, color change, or trouble walking, that deserves attention. Poor circulation can make the feet feel cold. Nerve problems can change how temperature feels. And sometimes people have both. Pay attention to patterns. Are your feet cold even in a warm room? Are they pale, bluish, or painful? Is one side different? Those are useful clues. The hands can also say a lot. If your fingers swell and your rings suddenly feel tight, that may be a sign of fluid retention. If your fingertips turn pale or bluish, especially when cold, that may point to circulation changes. If your hands feel weak, clumsy, or numb, that can be related to nerve compression, arthritis, circulation issues, or other medical problems. And if one hand suddenly becomes weak or numb, especially if it comes with face drooping, slurred speech, sudden confusion, trouble walking, or vision changes, that is an emergency. Sudden weakness in one arm or one leg is never something to watch overnight. I want to stay with that for a moment, because stroke warning signs are easy to miss when they come on suddenly. If a person has sudden balance trouble, sudden vision changes, sudden face drooping, sudden arm weakness, or sudden speech trouble, call emergency services right away. Do not drive yourself if you are not safe to drive. Do not wait for it to pass. Do not go make tea and sit down to see if it improves. When it comes to stroke, minutes matter. Quick care can protect the brain. This is one of the clearest examples of why body signals should be taken seriously. Let's talk about leg cramps, because so many older adults deal with them at night and simply suffer through them. A leg cramp may feel like a hard knot in the calf or foot that grabs you out of sleep. Sometimes it is linked to overuse, tight muscles, dehydration, or inactivity. Sometimes medicines can play a role. Water pills, some cholesterol medicines, and other prescriptions may add to cramps in some people. That does not mean you should stop anything on your own. Please do not do that. It does mean it may be wise to ask your doctor or pharmacist for a medication review if cramps, dizziness, weakness, or swelling started after a new medicine or a dose change. This is where many people feel overwhelmed. They say, "Dr. Amelia, how am I supposed to know what matters when I have so many little symptoms?" And that is a fair question. You do not need to figure it all out yourself. You are not trying to diagnose your body like a machine. You are simply gathering clues. The goal is not to panic over every ache. The goal is to notice patterns. A symptom once may mean very little. A symptom that repeats, grows, or comes with other signs tells a stronger story. And patterns are what help your healthcare team know where to look. One simple thing I encourage many older adults to do is what I call the shoe, sock, and step check. It takes less than a minute. At the end of the day, notice whether your shoes feel tighter than usual. Look at your socks. Are there deep marks from swelling? Then take a few steps and ask yourself whether your legs feel heavy, painful, weak, or unsteady. After that, look at your feet. Are they a normal color? Do you see a blister, sore, crack, or nail change? Finally, glance at your hands. Are your rings tighter? Are your fingers puffy, pale, blue, or numb? This small habit can help you catch changes earlier. It can also help to keep a very simple note on paper or in your phone. You do not need a full diary. Just a few words when something stands out. Both ankles swollen after dinner. Left calf pain after walking. Feet burning at bedtime. Right hand numb this morning. Leg cramp after starting new pill. These kinds of notes can be surprisingly helpful. They turn a vague feeling into useful information. They also help you remember what happened, how long it lasted, and whether it is getting better, worse, or staying the same. Now let's talk about skin and nails, because they are often forgotten. The skin on your legs and feet can change when blood flow is poor or when swelling has been building for a long time. You may notice shiny skin, dry skin, slower healing, color changes, or less hair on the lower legs. Toenails may become thick, brittle, yellow, or slow to grow. These changes may not seem dramatic, but they can add to the picture. If a foot wound does not heal, if a sore keeps returning, or if the skin starts turning dark, red, or unusually pale, do not try to manage that alone for too long. It is better to ask early. There is another issue I want to mention because it affects so many people over 60, and that is dizziness when standing up. You may wonder why I'm bringing this up in a video about hands, feet, and legs. The reason is simple. Dizziness changes how safely you use your legs. If you stand up and feel faint, your risk of falling goes up fast. And falls can change a life in an instant. Dizziness may be linked to dehydration, low blood pressure when standing, certain medicines, heart rhythm problems, or other causes. If you feel lightheaded when you rise, stand up more slowly and let your doctor know, especially if you are also weak, unsteady, or taking several medicines. Speaking of medicines, here is one of the smartest habits you can build after 60. At least once in a while, ask for a full medication review. Bring all prescription drugs, over-the-counter medicines, vitamins, and supplements. Ask simple questions. Could any of these be causing swelling? Could any of these be making me dizzy? Could they be affecting my kidneys, my blood pressure, or my balance? Could they be adding to leg cramps, numbness, or fatigue? Many people are surprised to learn that side effects can creep in slowly, especially when several medicines are taken together. Never stop a prescribed medicine suddenly unless a qualified clinician tells you to. But never assume symptoms are unrelated either. Hydration is another quiet factor that can affect how your hands, feet, and legs feel. Some older adults do not drink enough because they are worried about bathroom trips. Others are told to limit fluids because of heart or kidney problems. This is why it is so important not to follow generic advice without considering your own health. Too little fluid may lead to dizziness, cramps, weakness, and confusion. Too much fluid may worsen swelling in some people. If you have heart failure, kidney disease, or take water pills, ask your doctor what amount of fluid is right for you. Personal advice matters here. I also want to touch on the heart, because the legs and feet can reveal heart strain before people think to look there. If swelling comes with shortness of breath, needing more pillows at night, unusual fatigue, or sudden weight gain over a few days, that can point to fluid buildup. Some people say they simply feel more tired walking from room to room. Others notice their legs feel heavy and their shoes no longer fit well by evening. These are not signs to ignore. Again, not every swollen ankle means heart trouble. But swelling plus breathlessness plus fatigue is a combination that deserves prompt attention. The kidneys can also leave clues in the lower body. When kidneys are not handling fluid the way they should, swelling in the feet and ankles may show up. Some people also feel more tired, have poor appetite, muscle cramps, itchy skin, or changes in urination. That does not mean you can tell from symptoms alone what is happening. You cannot. But you can notice the pattern and bring it forward. A simple lab test can often tell much more than guessing at home. That is why I want you to think of symptoms as signals, not answers. The signal says, please look closer. Let's take a moment for caregivers, because if you are watching on behalf of a parent, spouse, or loved one, you may notice signs before they do. You may be the first to see that one slipper is hard to get on, or that a person is rubbing their calves, walking more slowly, or avoiding stairs. You may see deep sock marks, a new limp, or a foot sore they cannot see. Caregivers often feel unsure about when to speak up. Please trust your observations. You do not need to diagnose anything. You can simply say, I noticed your left leg looks more swollen, or I've seen you stop a lot when walking, or your foot looks red. Those simple observations can be very helpful. Now I want to give you a few red flags in the clearest language I can. Get urgent or emergency help right away if you have sudden one-sided weakness or numbness, face drooping, new speech trouble, sudden severe confusion, sudden trouble walking, or sudden vision changes. Get urgent help if one leg becomes suddenly swollen, warm, red, and painful, especially in the calf. Get emergency help if swelling or leg pain comes with chest pain, sudden shortness of breath, fainting, or coughing up blood. And if you have severe swelling with trouble breathing, that also needs prompt care. These are not signs to self-treat with internet advice. For everyday concerns that are not emergencies, A few practical habits can go a long way. Keep moving during the day instead of sitting for long stretches. Even short walks around the house help your legs. If you sit a lot, gently flex your ankles and wiggle your toes now and then. Wear shoes that fit and protect your feet. Keep the skin moisturized, but avoid putting lotion between the toes if moisture tends to get trapped there. Trim nails carefully, and if you cannot see or reach your feet well, ask for help rather than risking injury. These are simple habits, but they protect comfort, safety, and independence. If walking has become harder, please do not assume the answer is to move less. Sometimes people stop moving because their legs hurt or feel weak, but that can lead to even more weakness. The better question is, why has walking changed? Is it pain? Balance? Breathing? Fear of falling? Numbness? Joint stiffness? When you understand the reason, you can get the right kind of help. Some people benefit from better shoes, physical therapy, medication review, blood flow testing, or diabetes foot care. The goal is not to push through pain blindly. The goal is to protect mobility in a safe way. Here is another small but powerful step. At your next appointment, do not just say, "My legs bother me." Be more specific. Say, "My calves hurt after 5 minutes of walking." Say, "Both ankles swell by evening." Say, "My right foot burns at night." Say, "My left leg is more swollen than the right." Say, "I feel dizzy when I stand." Say, "I've had more numbness since starting a new medication." Clear details help your doctor or nurse know what to ask next. It may feel like a small difference, but specific symptoms often lead to better conversations and faster answers. I also want to reassure you of something. Not every change means something terrible. Aging bodies do change. Veins can become less efficient. Joints stiffen. Muscles weaken if they are not used. Skin dries. Nails thicken. Some swelling after a long day may be harmless. But the reason this conversation matters is not to frighten you. It is to give you confidence. Confidence comes from knowing what to notice, when to speak up, and when not to brush things aside. Fear says, "Something is wrong and I'm powerless." Wisdom says, "I can notice a change, respond early, and get help when I need it." That is really the heart of healthy aging. Not pretending nothing is happening. Not panicking over every symptom. But paying attention with calm and care. Your hands, feet, and legs help you cook, clean, walk, garden, hold loved ones, and stay independent. They deserve your attention. When they change, listen. When patterns appear, write them down. When something feels off, ask. And when warning signs are sudden or severe, act quickly. Small actions taken early can protect the life you want to keep living. So here is the one simple next step I want you to take after this video. Tonight, before bed, do your own quiet check. Look at your hands. Look at your feet. Look at your legs. Notice swelling, color, numbness, pain, temperature, and balance. Do not overthink it. Just notice. That 1 minute of awareness may tell you more than you expect. And if you see something that has been trying to get your attention, let today be the day you stop ignoring it. If this message helped you, share it with someone you care about. A brother, a sister, a parent, a spouse, a friend who keeps saying, "It's probably nothing." And if you want, tell me in the comments which sign stood out to you the most, or which symptom you plan to pay closer attention to starting today. I'm glad you were here with me. Take good care of yourself, stay curious about what your body is telling you, and remember that noticing small changes is not worrying too much. Sometimes it is one of the wisest things you can do.